All right, all right. Yo, yo. Welcome to another episode of Weirdinary. I'm your host, BradQuan, and today I have a very special guest. She is a board-certified physician assistant practicing since 2018, holds a bachelor's in natural science from Fordham University and a master's of PA studies from SUNY Upstate Medical University, has a background in urgent care, primary care, hospital medicine, and intensive care, practices integrative wellness and medical aesthetics, is an energy healing enthusiast, Reiki in particular, founder of the eco-friendly, clean-scented, Reiki-infused Intention RX candle company, and is a lover of nature, gardening, and wildlife all the same. And if I'm not mistaken, you have 3 pugs, yes?
Yeah, I sure do.
Yo, rock and roll, man. Listen.
You got it, man.
Jess
You got it.
Pollins.
You got it.
I got it right. Oh my
You
God.
got it,
Yes.
you got
How the
it.
hell are you?
Good, man. Thanks. Thanks for having me.
Yes. Thank you for agreeing.
Absolutely.
You know what I mean? Like I said, you are a very busy woman, very impressive resume. You know what I mean? I'm sure there are a million things you could have been doing on this lovely Wednesday morning, but you decided to spend it with us here today on the set of Weirdinary here at the Moon River Cafe.
Cheers. Thanks, man. Appreciate it.
Absolutely, and it means the absolute world to me, man. I mean, how is everything? I mean, please bring us to a day to day. I mean, first off, do you work today? Are you off?
I'm off today.
Rock and roll.
I've got a good balance of my schedule, and it's taken me a couple of years to figure out a work-life balance, but to be able to kind of block my hospital shifts a little bit more concisely, and then blocking my integrative health and wellness and aesthetic shifts a little bit more concisely so that I do have some dedicated time off. So that's one of those days.
Fair enough.
Yeah.
It's really interesting. I heard somebody say working in a hospital setting, they never gotten like sick so many times. I mean, have you like noticed any like changes within your immune system working in a hospital by chance, or?
I've been pretty not sick for quite a while. Funny enough, though, I did catch COVID this past April from a patient of mine.
Yeah, that was so crazy.
But that's the first time I've been sick in a really long time.
It's crazy. We literally forget about
That
the
it's
fact
still a
that
thing?
people still, yeah.
Yeah,
I mean,
yeah,
it's
yeah.
so different now. I think. Do you have to quarantine now? Is it still? It's
No.
not really a thing anymore.
No,
Right?
only if you have an active fever,
Yeah.
they don't want you coming to work.
Fair enough.
So 48 hours fever-free, I think, is the rule still. You need to be fever-free for 48 hours, and then you can go back to work. But you can still, even though if you're testing positive or still symptomatic, as long as you're fever-free, you can still go back to work.
Well, talk about COVID.
Yeah.
You've been active since 2018.
Yep.
COVID, of course, that struck that was 2020, correct? Or was it 2021? It's 2020, I believe.
It
right?
was early 2020. So
think it
the
was
world
March
started
of
shutting
2020.
down the very end of 2019. Like
Yeah.
we started getting wind of it in like December, January, and then March of 2020
is when it
the world
really
shut
started
down.
shutting down. Okay, so when that happened, I mean, like, how? Because you were in the hospital and everything. I mean, like, what was that like? I mean, just because I don't think I've ever really asked anybody in the medical field about their experience. Like, I really want to like be in your shoes. You know what I mean? To understand what that was. I mean, I can only imagine, like. Because for me, when I heard about it, it felt like otherworldly. You know what I mean? It felt like I was a part of like a fictional, novel or something like that. I'm like, the world is shutting down.
Yeah,
This is actually
literally,
happening. You know what I
literally.
mean? But like, it's a lot of stress. I mean, just take me through your mindset, your consciousness during that particular time as a medical employee,
Yeah,
a medical
so
professional.
I was still solely practicing hospital medicine at that time before I kind of delved into the world of critical care. And I just started delving into the world of critical care right as things were changing. So I was one of the first physician assistants to help build and start our step-down ICU unit, which is a conversation for another time, that has essentially turned into a full-blown ICU at this point in time. And because of COVID has turned into a full-blown ICU. But there was a lot of uncertainty and speculation as to what was coming. What was to be expected was there was nothing. We didn't know. We didn't know what was happening. We didn't know what was coming. There wasn't a lot of communication from the government or anything like that as to what was happening, how we should go about these things. This is all brand new territory. We didn't know what we were dealing with, how to treat it, the resources that we needed. It was quite terrifying, and it felt like we didn't have a choice but to delve in head first, because if not us, then who? The hero complex in us healthcare providers, I guess. But it was interesting. It was a really ominous time. I remember before the virus hit New York State, I was holding a position in our hospital system that kind of fields all of the phone calls from the emergency department, from outside hospitals, outside facilities for admissions to the hospital, and then we triage where the patients need to go, the level of care that they need. And I took a phone call from Southwest Vermont Hospital on a really sick patient that has this terrible pneumonia. They've never seen anything like it. Don't know what's going on. We can't keep him here. We don't have the resources with how to treat him. We don't know what to do. He just can't stay here. And I said, I think we know what we're dealing with. You need to keep that guy there. Please don't put him in an ambulance. Do not helicopter him to our hospital. We don't know what's going on. And this is before New York State, before COVID was confirmed in New York State.
Yes.
And at that time, the COVID testing was taking a week, if not longer, to come back. So they had sent the test off, but we were still many days out from actually confirming what we were dealing with. But in actuality, we knew it was happening. And I jokingly say, I don't know if this is true or not, but I think I blocked one of the very first COVID patients coming to New York State or being tested positive, confirmed in New York State. Is within 6 hours later, the news announced that Southwest Vermont Hospital announced their very first COVID patient. It was quite terrifying. We didn't have immunity. We didn't have vaccines at the time, and that's a whole nother conversation for another time. We didn't know what we were walking into and what we were dealing with. There were no rules or support or guidance in terms of how to treat and how to support these patients and how to take care of ourselves and how to support and protect ourselves. There was none of that. So it was very in the dark, very very scary. I remember donning my PPE, the personal protective equipment.
Yes.
You know, the hair, the gloves, and the eye gear, the gowns, everything. For the very first time, going into my first presumed positive COVID patient for the very first time, and taking a deep breath before I walked into that room and saying, here goes nothing. We don't know what I'm walking into. Here goes nothing. And on the other side of that door was the sickest person I've ever seen in my entire life, and I had barely been practicing for 2 years at that point.
Oh my God.
It was interesting. And then over the next couple of weeks, you know, things got worse and people got sicker, and, you know, I'm sitting around, at that time I was maybe 27, 28, and, you know, getting worse, PTSD, man. My friends and I, we were sitting around in our little shared office space, which, you know, they tell you don't sit with people. We're gowned up and gloved up, and we're signing, you know, advanced directives for each other and healthcare proxies for each other, because God forbid if something happened to us, if we weren't married, we had no one to look out for us, no one to, I don't know, make medical decisions for us. And at 28 years old, we're signing healthcare proxy papers because we don't know what's going to happen. Or it was an interesting time.
My God.
It was an interesting time. Yeah. My heart's racing thinking about it, man. Yeah.
That's actually a really good springboard into our backwards dive, so to speak. I wanna swim. I wanna course through the past and work our way back into the present.
Sure.
All that said, because you said like you were seeing like the sickest people you've ever seen. You know what I mean? You were seeing during that time.
Yep.
So, my first question to you, Jess, when you think back to your childhood, what experience first shaped the way you understand pain, whether it was your own or someone else's?
Damn. You really dig it in.
Weirdinary.
I appreciate that, man. I appreciate that. I don't know. I grew up on Long Island, lower middle class, blue collar family. The long story short of it is I lost both of my parents to drugs and alcohol many years ago. My dad when I was 13, or just turning 13, and my mom 10 years later when I was 23, turning 24.
Damn, we have a parallels in that. So,
Yeah?
wow, yeah, absolutely. Holy shit.
Yeah, man.
Please continue. Oh my
Yeah.
God.
So, I don't even, I'm a little ADHD. Your question was pain?
I'll repeat. Yes. I'll repeat it.
Thanks.
When you think back to your childhood, what experience first
Yeah.
shaped the way you understood pain, whether it was your own or someone else's?
Fair enough. So yeah, going back to that.
You said you lost both your parents to drug and alcohol abuse.
Yeah.
Oh my God.
Yeah,
Okay.
mental health, big time, and so I felt like my whole childhood was living in a constant state of fight or flight and watching everyone else's pain. And for whatever reason, from a very young age, I said to myself that that's not going to be me, and I'm not going to do that, and I'm not going to continue those patterns, and I'm not going to carry those, whatever that was, forward into my life, and that I needed to do something different. And I've got a younger sister who's about 2 years younger than me, and she's still with us, but I'm estranged from her at this point in my life because of drugs and alcohol and mental health issues and the struggles of our childhood growing up. So going back to the pain, I'm nervous, I'm sorry.
You're fine.
A lot of it, I kind of said to myself that I wasn't going to continue living that and bringing that into my life today in my adulthood. And sorry, I'm a little distracted.
No, you're fine. Just be mindful of the microphone is all. Yeah,
Thank you.
Yeah. No, it's all good.
How has that affected me today, essentially, right? Is that the question? I'm sorry.
Yeah. I wanna understand, like, I guess how your understanding, your understanding of pain has essentially how it impacted your perception of reality.
Fair enough.
I mean, losing your dad at 13. I mean, that's your formative years.
Yeah.
You know what I'm saying?
Yeah,
I mean,
so-
first off, I'm sorry to cut you off.
No, I appreciate it.
How was your relationship with your father? Like, you guys had a good relationship, or like, what was it?
Yeah. He did the best that he could with what he had. Both of my parents weren't well educated. They, grew up latchkey kids also came from broken homes. And they got together at a very young age, I think when they were 13. And they grew up trauma bonded together and just unfortunately spiraled themselves. But I had a very close relationship with my dad, given the circumstances and what I knew, but I knew too much at a very young age. So it was, I don't know, I was way more aware of the circumstances and what was happening behind the scenes than I probably should have been as a young child.
Felt like that kind of forced you to grow up quicker?
Oh, yeah. Mm-hmm.
Yeah.
And then carrying that pain forward into my adulthood, I said that this is not something that I was going to continue to do, something that I wasn't going to bring into my adult life, and figuring out how to break that mold and try to find a life of peace that they never had.
Mm-hmm.
So that's kind of been my motivation in life, is finding that peace and security and love that I know I deserve and that we deserve in this lifetime, that the two of them thought that I don't know, maybe they thought that they had, maybe they thought that they deserved, that's what they thought that they deserved, but that's clearly not what they deserved.
So, okay, so can we get into the, you said drugs and alcohol.
Yeah.
What kind of drugs, if you don't mind me asking?
My dad was a big cocaine addict, lots of marijuana. But yeah, those are the biggest things that I'm aware of. And then, as a young child, I've seen things, I've definitely seen him doing and sneaking cocaine or, things like that. And then my mom, unfortunately, my dad was my mom's first true love and her only love in her entire life. Mm-hmm. And when he passed away, she never grieved. And then a couple of years down the road, her way of grieving was her mental health spiraling. And on top of perimenopause, menopause, now that I know what I know now, all of these things, culmination of mental health and lack of systemic healthcare support, she was lost to the system and her mental health spiraled, and she basically drank herself to death.
Jesus.
Yeah.
The spiraling of the mental health. What did that manifest into anything in particular? Like was there ever like an actual diagnosis there, or was it just like a culmination of things based on what you understood?
I think it was a culmination of things. I mean, she was diagnosed with depression, clinical depression, and was given antidepressants, SSRIs, but she refused to take them and instead self-medicated with alcohol.
Yeah. And I asked not to pry, but only
okay.
because
I'm an open book.
Fair enough. I have an immense interest, as you probably know, just in psychology and whatnot. And like I said, I mean, I lost both my parents. I have a very firm understanding of the dark side of mental health from personal experience, as well as things that I've seen. You know what I mean? And just people getting lost in the system.
Yep.
I hear that all too often.
Yep.
You know, what do you think the system lacks? You know, that because I mean, you're definitely a mental health advocate as well. I'm actually pissed off that I didn't mention that in your introduction as well. But what do you believe? What do you believe the system lacks that you can bring to the table? Because, and I want to eventually get into the energy healing thing as well, because that's a part of it. But from your experience, based on what you've observed, what's missing to you that causes such things? Like, obviously something is possible. Is it possible that something could have been done by the system to help your mother, or at least better put her in a position where it didn't have to go that way, you know?
A lot of it's just time. It's as simple as time.
Okay.
Primary care providers, healthcare providers don't have time to sit and actually delve into problems, especially in the outpatient community. She unfortunately was her own worst enemy, and refused to seek the care that she needed. And this was all culminating in the years, like my last 2-ish years of undergraduate at Fordham. Things were kind of spiraling a lot out of control, and my sister's mental health and her addiction as well was spiraling with my mother's at the same time. They were living under the same roof, so they snowballed together.
Shit.
They snowballed together. And when I was in college, and then the year or so after I graduated, I was waiting for a phone call for one, if not both of them. So it was just a matter of who and when, not a matter of if. So a lot of it's just time and their lack of motivation to seek the care that they needed. But I think it was to the point where they were too far gone to actually recognize that there was an issue. I mean, I think that they definitely recognized that there was an issue. My mom definitely recognized that there was an issue, but I don't think that she felt that she deserved the support and the healing and the care that she needed to make a full recovery, or make any sort of recovery to continue living in this life or in this earthly plane. Yeah.
You said time is an issue within the system. Obviously this country, from state to state, nationwide, there's more than enough funds to make sure that that there's adequate employment and that people are paid accordingly based on, given the skills they have to provide. I mean, I guess that's something I really wanna understand. Like, what the hell? Like, why with all the resources we have? Why don't we? Because essentially, you feel like these professionals don't have enough. You say they don't have enough time, so they don't have enough support around them.
Correct.
To ensure.
And it's not the healthcare provider's fault by any means. It's the greater system that puts them into this grind, this crunch, this. You get 15 minutes in an office setting, and then that's all you get. office and even the hospital work is pushed by RVUs or as a better way to describe it, it would be like generating. The more patients you see, the more income you generate for the practice, for the hospital, the more you're rewarded, to a certain extent, of course. But the number of patients that need to be seen in the course of the day, you would think that there's enough healthcare providers, but there's never actually enough to actually see the amount of people that need to be seen, that deserve the amount of time and care that they deserve. It's never enough. It's never enough. I mean, knowing what I know now and looking back at my mother's experiences with her primary care, she would go to her primary care looking for support with alcohol withdrawal and detox. And that's something that should be managed in a hospital setting. That you shouldn't be trying to deal with severe alcohol withdrawal in the community by any means. Alcohol withdrawal can be deadly.
Yeah, she can kill you.
Deadly.
I believe that as well as Xanax withdrawal.
Benzo withdrawal can kill you.
Yeah,
correct.
yeah.
And these doctors failed to recognize the severity of her illness, failed to recognize the severity of her mental health issues. Would throw a couple of pills here and there at her to try and help her get through the withdrawal, because she was also stubborn and refused to actually seek the appropriate care that she needed, now knowing she needed to be hospitalized to get through these. And here and there she would go into the hospital to get through the withdrawal, and then she'd sign herself out and then do this whole thing all over again. And then she would occasionally seek support of her primary care. They would throw her a couple of pills of something like Librium or a long-acting benzo to try and help her get through the withdrawal. But now, what I know now, looking back, she was still dealing with DTs, which can be dangerous. It can be deadly. DTs can be dangerous, or delirium tremens.
DTs, okay.
Delirium tremens is the worst state of alcohol withdrawal that someone can experience.
Explain that to me.
Delirium tremens, you've got a wide range of like withdrawal symptoms or that someone can experience, from something as simple as mild anxiety, tremors, shakes, sweats and chills, nausea, vomiting, diarrhea, as far as hallucinations, cognitive distortions, and then the worst of it being seizures. So once we start hitting, in the hospital system, we rank and score. It's called the CWA scoring. We score how severe your withdrawal symptoms are, sometimes upwards of hourly. And sorry, thank you. And we will medicate with benzos to get you through that withdrawal period to prevent seizures from developing. Because if you hit seizures, then that's the be-all, end-all in terms of withdrawal symptoms. That could theoretically be extraordinarily dangerous and deadly. And once you start having seizures, the likelihood of them progressing to a full, status epilepticus sort of situation in severe withdrawal, and then all the other issues that go along with alcohol withdrawal, like your electrolyte disorders and low sodium, potassium issues. You start thinking about cardiac arrhythmias and sudden cardiac death, brain death. It's a wide range of spiraling in terms of withdrawal symptoms, and trying to prevent that from happening is number one goal. And the severity of my mother's withdrawal should never have been managed in the outpatient setting. And the primary care did the best that they could with what they had, knowing what they knew, which wasn't a whole lot, because my mother wasn't very transparent with her symptoms and what she was dealing with. And she refused to go to the hospital to get through these things. But if maybe someone had a little bit more time to sit and actually have a conversation with her and have the ability to show the empathy and compassion, maybe we would have gained a little bit more trust and support and I don't know, reliability in the healthcare system to get her the support that she needed, or at least gain her trust so that she would sit and actually develop a relationship with her providers and hopefully, maybe ideally, get her the care that she needed. But I don't know, she was her own worst enemy, so.
Yeah, fair enough. We all are
Yep.
our own worst enemy.
Yep.
And it's just like, I don't know, understanding the ample resources that we have, again, from state to state and nationwide, and understanding how they're essentially misappropriated, you know what
Yep.
I mean? It's just it takes away from the humanity
Yep.
of these fields. You know, 'cause
Exactly.
I imagine these medical professionals want.
Correct.
Yeah, you get into it because you want to help people.
Exactly.
You want to make a difference, and it's just like, damn, like when you don't have the time because there's just not enough help around you, enough support to give people what they need, and it just leads to such destruction.
Right.
Demise. It's like, god damn it, man.
Right.
It make you question, like, what did I get into? Like, is this what I signed up for?
Oh yeah, often. And you know what? Aside from the providers not having enough time, I think a lot of it too. It's definitely a two-way street in the sense that patients don't have the knowledge and understanding of what it means to be in the healthcare provider's shoes and what they're trying to do in the limited time that they do have to spend with said patient. And it's often more of a struggle to try to convince and gain their trust and understanding and educate these patients towards the reasons that they need to be, on whatever they need to be educated on, to understand the constraints of the time that we have with them and how limited time that we have and what we can do with them and for them in that time. And so often it's just a snowball of mistrust and mismanagement, because I don't know, we're all button heads from that perspective, and it's no one's fault of the providers, of the patients. It's just more of a systemic issue that any of us can deal with. Even in the hospital setting, I'm expected to see, if I'm not in a critical care situation, I'm expected to see 1 or 2 patients an hour, and I've got an entire lifespan of medical issues that I have to manage. Jesus. And keep people safe. And on top of that, maybe I'm seeing patients at the bedside for 5 to 10, maybe 15 minutes at a time, and I'm spending maybe 60%, 70% of my day behind a computer documenting all these things because of the Medicaid, Medicare, whatever insurance-based documentation that all these metrics I need to meet, and the number of patients I need to see per hour per day, and it's inpatient, outpatient, is all the same. We are put in an interesting situation where we have to spend more time explaining and delegating or explaining ourselves and documenting and, I don't know, not being able to be patient-centered and patient-focused and at the bedside. And we're more so sitting behind a computer, spending our lives typing away and documenting away and arguing for the things that we are trying to do for our patients. And advocating for our patients that way, so patients don't see the amount of work that we put in behind the scenes as well. So that's also part of it. Yeah.
As you moved through adolescence, what part of yourself did you feel people misunderstood the most? And how did that shape the woman you became?
I was always the black sheep. What?
How so?
Like going back to what I was saying before, like I always said that's not going to be me.
Yes.
Growing up, when my mother and sister were in the throes of their mental health and addiction, especially in my high school years, we had an interesting upbringing. My mother was the best mom I could ever ask for, my best friend. I would do anything for her and to have her back here, but knowing what I know now, I say this all the time, the mental health part of it was so severely distorted and unstable, and there was no sense of self, no sense of identity, no sense of what love and empathy and compassion actually meant, because I wasn't following suit in all of those things that they were doing and the spiraling that they were partaking in together. I was often told that I'm just as awful of a person as they were. I'm not as smart as I think I am. I'm not going to amount to the things that I think I'm going to amount to, and I'm not going to be the person that I tell everyone that I'm going to, because I want to go to medical school. I want to be a doctor, a physician. But I grew up telling myself, fuck you guys, watch me. And things changed, and my mother's mental health and her passing kind of pivoted my life's plans away from medical school towards physician assistant school, and I have no regrets because of that. But I'm the first person in my whole entire family to graduate high school, and my extended family to go to undergraduate to get a degree, and not to mention a master's degree and doing all the things that I'm doing now. So yeah, that's kind of how it all came to be and how I got to this point here. And I grew up being the black sheep, and my sisters and I relationship is still kind of, and that's still kind of, it is butting heads because I've always been the black sheep and breaking the mold. And she continues in patterns and ways that I just, had to put some boundaries up.
You were the black sheep for a positive reason.
Yeah.
So many of us, including myself, are black sheeps for the negative reason.
Fair enough.
It's interesting. So losing both parents and understanding the depths of certain things so early on, it forces you to grow up quicker. And a lot of the times as people grow older, it forces them to regress because when you don't have the ability to be a child during your formative years and you get the freedom as an adult, you regress back to that time that you lost, right? And you behave in such ways, you know what I mean, to try to, make up for lost time. That didn't happen to you, it sounds like, at least not externally. I mean, I don't know. What did that manifest into something like maybe like an internal hurricane more so, because like a lot of people, they spiral after the fact, you know what I mean? I just I want to know all that, I mean, did that, let's try to figure out the best way to say this. How did growing up so soon, quicker than you wanted to, how did that impact you internally, as you graduating college and all that stuff, because obviously you didn't have you weren't in the throes of addiction or anything like that, so it was all internal. It was all internal.
Yeah. I was a neurotic mess.
That's what I'm saying. Explain to me the internal hurricane that you had to maneuver through in order to find stability.
Yeah. I grew up, and then all through high school and college, having an internal sense of extreme anxiety, living, on a 10 out of 10 scale in terms of fight or flight mode all of the time. And I internalized all of that, and a lot of it because I said, fuck you guys, watch me, I'm going to break the mold and do the things. It culminated into extreme control, neurotic sort of mental health, overachievement. So overachievement to the utmost extreme, to the point where I had my own mental health breakdown in undergraduate because I just wasn't sleeping. I couldn't think straight. I was clearly undiagnosed anxiety and ADHD all through all of my high school and undergraduate career, to the point where I was almost failing my classes in my undergraduate career because I didn't know how to actually externalize any of this anxiety and neuroticism that I was culminating in the sense of all the things I wasn't going to do and wasn't going to be. And it took a lot of unlearning and many, many years of therapy and many, many years of medications. Lots of energy work and soul searching and healing from that perspective to undo all of the things that I've learned and all of the traumas that I've, carried all these years. Mm-hmm. It took many, many years of healing to undo and unravel all those webs that were weaved, and to find some inner sense of peace and compassion for myself. So it was a lot, and a lot of my coping was, like I said, in overachieving and overperforming and overdoing, and I coped and survived with my head in the books for whatever reason. God bless it. That's the way that my brain and my heart and soul decided to, cope and survive, is putting my head in the books and studying and doing the things that I did. I'm very blessed that that's the path that I was meant to go down.
Were you seeking validation?
Oh yeah, 100%.
You feel like you didn't get that at home?
No. Yeah. I was a varsity athlete as a freshman. I did all, I was in all the honor societies. I played I was classically trained in viola. I played Lincoln Center in high school. You know, I did the things. I did the things.
Lincoln Center?
Yeah.
Wait, that's in Philadelphia, right?
New York City.
New York City.
Yeah.
God damn.
It's like the equivalent to Carnegie Hall. So I did all of the things looking for all of the validation I never actually saw.
Shout out Andrew Carnegie. Dude, holy shit, man.
Yeah, I did some crazy cool shit, man. I did some really cool stuff looking back at all of the things, and I grieve a lot of the things I used to do because I don't do those things anymore. I can't play sports anymore. I've sustained too many injuries. I put down my viola after I graduated undergraduate because it just didn't follow me with everything going on. I mean, I still have it at home and I'll pick it up for fun every now and then, but it's not the same. And
What sport did you play?
softball and volleyball. Volleyball more seriously.
You see you spiking the hell.
Yeah, man.
Oh my God.
Yeah.
So,
It was good.
my next question for you, Jess. What struggle from your early adulthood forced you to grow in a way you never would have chosen for yourself?
Early adulthood, what time period? All of it?
What do you, because you're 35 now?
I'll be 34 next month.
34 next month. Okay, fair enough.
Yeah.
Fair enough.
I mean, honestly, the biggest, not to keep talking about death and dying, but the biggest turning point in my life was losing my mom. She passed away. So she had an out-of-hospital cardiac arrest about a month or so before I was set to pack my life up and move from Brooklyn to Syracuse to start grad school for PA school. And so she was in the hospital on a ventilator for almost 2 weeks. And this is before I knew anything about medicine, before I knew anything about what this meant for her and what for my life. And I felt like I was failed from the hospital system in that perspective, not being well informed in terms of her prognosis and what had happened and what that meant for her. Again, going back to doctors just don't have the time and the resources to actually sit and educate young people that don't know, or healthcare illiterate people and health education illiterate people that don't understand the consequences of someone's actions or what something has happened or what had happened to someone. And that was the biggest turning point in my life and the biggest thing that has kind of shaped me as an adult today. Having to deal with that trauma. And then immediately 3 weeks later, I packed my life up and moved for grad school. And then I learned about everything that had happened to her. It was a traumatic healing process, going through and learning all of the mechanisms and just everything that she went through and understanding the science behind the suffering and the struggling. It was what's a good way to put it? A tough, very tough time, but also a healing time in the sense that I was able to process and understand and find forgiveness in the struggles that she was dealing with, because I knew that they were bigger than her and they were bigger than me, because I always said, if my mom loved me that much or loved me as much as she said she would do this for me. And I think that was part of what drove me to be such an overachiever and do all the things that I did looking for validation. And when she couldn't do those things, I said, I need to do that for myself.
But even through that discomfort, you still managed to graduate.
Yeah.
When my father died when I was in college, I dropped out. I couldn't deal with it. There was no fucking way.
Yeah.
You know what I mean? The fortitude, the resilience. Your wiring was so. It was so solid. It was so sturdy. You know what I mean?
It was survival. It was survival. And that's really all it was. Because I said to myself, when my mom's health wasn't doing well, it was going to take me many more years to even think about getting into medical school. Because my undergraduate grades suffered. I wasn't a great test taker. I didn't do well on the medical school entrance exam because I didn't know how to study and undiagnosed anxiety and ADHD. It wasn't working for me. And at the time, I said, when I was working in urgent care in New York City, and all of my colleagues were switching gears and dropping the med school dream and doing the PA school thing before it was the cool thing to do. And I said, fuck it, that's what I'm going to do. I'm going to get into PA school. It'll be a lot easier, quicker, or what I thought was easier and quicker. It wasn't easier at all. It's just as competitive, if not more competitive, to get into PA school these days than it is to get into medical school. But for some reason, I said in my head, I need a career, I need some financial stability, I need to do something for myself now before it gets worse. And I just woke up one day in the middle of March of, 2014 and said, 2015 maybe, 2015, I need to do something different.
Is it possible, I'm going to make an assumption here.
Go for it.
And listen, if I'm reaching, please put me in my place, all right? Your predisposition for addiction, it's possible that it didn't miss you, but instead it just manifested into an addiction to achievement.
Oh, 100%. 100%.
Fair enough.
Yeah.
Okay.
Yeah.
Okay.
And I knew, so I grew up on Long Island, and I knew if I went back home after I graduated undergrad, which my mother begged me to do, please go home. She wanted me to fall in line with the rest of them and take care of them. And I 99% would have guaranteed I would have fallen into some shape of addiction with the rest of them. But these predispositions, this shit is it's inevitable. Yeah.
You know what I'm saying?
100%.
Okay, that's ultimately that's what I'm reaching for. Okay,
Yep.
all right,
Oh,
fair
yeah.
enough.
Oh, yeah,
You know
yeah,
what I mean?
yeah. Oh, yeah.
Okay,
Oh, yeah.
okay.
Yeah,
fair
yeah.
enough.
Oh, I was addicted to surviving, I guess.
When you said it was survival, it brought me to my understanding of addiction and how even when you know this shit is bad for you, like you crave it because you feel like you need it just to get through the day, the hours, the minutes.
Yep.
You know what I'm saying? Oh wow. Yeah.
Mm-hmm.
Oh god, school was everything. But you wanted that validation. You wanted that societal validation. You wanted to be. I'm trying to think here. You wanted to be. How did you want to be perceived? That's a better way for me to frame it instead of trying to figure out how did you want to be perceived.
I don't know that I knew. All I knew is I didn't want to be that.
Okay. Because I mean, there's obviously a stigma surrounding.
I think I was looking for some sort of title and some sort of accolades and status. That's a good word. To prove that I am who I am after all these years of being beaten down and told that I'm not those things. Just some inner sense of validation, and I don't know. I jokingly say I live a life of imposter syndrome and feeling like I live, first world white people problems of, boo-hoo, all these traumas and losses that I've lived and all of these, experiences I've had, and I've done some really cool shit, man. I've done some really cool things. I've met some really cool people. I've made some really cool impacts. But it still feels like first world people problems and white people problems that all these losses and all these accolades that I've gained is like, do I actually deserve it still even as an adult?
Our problems are our problems. That's just a reality. Like somebody might have it worse than you, but you still have your problems. You still have your perspective. But the fact that you can say that says that you're aware. You know what I'm saying? You're aware of the issues of. You're aware of the worldwide issues. You understand. You obviously understand racism. You understand poverty. You understand the woes of the world. You know what I'm saying? So
Appreciate that.
Yeah. I mean, just from that statement alone, that first world white people problems coming from a white woman,
Exactly.
that says so much about your perception of reality. It's quite interesting.
Yeah, and then not to be an uppity asshole about it either. Just like you said, I'm fully aware of my struggles and the shit I've been through, but I'm also fully aware, and I'm sure you're an empath. I can tell I'm an empath, and growing up and dealing with what we've dealt with, we have no other choice but to be empathic or learn how to be empathic for survival. I see and feel everyone else's struggles, and I'm sure you feel the same way, and that's probably why you sit in the chair that you do and do the things that you do, because you are completely aware of other people's struggles, but also their accolades and their victories.
Yeah.
And you like to highlight that.
Yeah, this shit is medicinal for me. I'm lost without it. It makes me.
It's really cool.
Yeah.
It's shit that I can't ever do. I can't do that.
I mean, hell, I can't do what you do. You know what I'm saying? You know what I mean? But the point is the connecting point that we share is the fact that we both choose to serve.
Right.
You know
we
what I'm
touch
saying?
lives in our own way.
Absolutely. I feel it's important. It's important to give everyday people their flowers. What you do is fucking phenomenal.
Appreciate that.
You know what I'm saying? It's interesting to me. You know what I mean? The unrelenting will to win, to make something of yourself, to believe that, yeah, you had imposter syndrome, but you always believe that you were deserving of better.
Thank you.
You know what I'm saying?
Yep.
And that's a level of self-love. You always loved yourself. You know what I mean? Is that fair to say?
Yeah, I think so.
You know what I mean? And not to say that there weren't some slips and whatnot, but
I think so.
ultimately, you know what I mean? No matter what you dealt with, there was always a connection to self-love.
I think so. I think that's a good way to put it.
Yeah, man.
Yeah,
That's
beautiful.
Yeah, that's it. I mean, hey, man, life is poetry,
Yeah.
That said, working in medicine means witnessing people at some of the hardest moments of your lives, as we talked about earlier, during your early days with COVID patients. What experience changed the way you see the fragility of being human more than any other?
I think often I go back to being on the other side of the bed as the patient and the family when my mother was in the hospital, and then I flipped myself as the provider on the provider side of the bed, and having both sides of the experience and understanding what both sides of those experiences look like and can feel like. I often say, especially in the hospital system, I've made it my life's mission to help support people in their darkest and worst of times, and when they are the sickest of the sick. And sometimes we can't make it out of the sick of the sick. If I can help guide and support them and make that stage of their life as peaceful and as tolerable of a process for the patient and the family and everyone involved as possible, that's all I could ask for. Because I didn't have anyone to do that for me. I didn't have the guidance and the support and the education and the transparency when I was on the patient side of the bed. Mm-hmm. And I try really hard to communicate as clearly as I can in whatever language that needs to be said or communicated, or however it needs to be said, whether it's soft or firm or what have you, in that sort of situation, and in the acuity of someone actively dying or someone spiraling out of control, and I have no control over that. How can I make that as tolerable of an experience and as peaceful and and help people understand and accept what's happening without pain? I mean, of course, it's going to be pain, but without grudges or mistrust and
without suffering
mentally more than physically as well. And I often say, when people are at that stage of their lives or their journey, or when it is time to transition to the next realm, whatever that is, or whatever that looks like for whoever it is, that the one thing I can promise people is lack of pain and suffering with medications, and support, and mental and emotional support, and just being there for them. That's the biggest thing that I strive to do and to be. Yeah.
What led you to believe that there was something about healing that medicine alone couldn't fully explain?
Yeah. I mean, clearly over the years I've had to do a lot of my own personal healing, physically, emotionally, mentally. And I've had to do a lot of soul searching and provider searching and a lot of holistic health to cure the issues that I was dealing with physically as well many years ago, as a culmination of all the stress and years of anxiety and untreated, or my own health that I pushed aside trying to get through school and doing all the things, and what it's culminated to. What was the question again? I'm sorry.
You're good. Listen, I am so glad to have somebody that I share this with.
Yeah.
When it happens in the moment, you feel like, God, is this person judging me?
Yeah.
Oh, no, you're not judging.
No.
I get it. I love it. Oh, my God. What led you to believe there was something about healing that medicine alone couldn't fully explain?
Yeah, okay. Dealing with all the things that I was dealing with from a physical, mental, emotional, psychological, energy, spiritual, whatever standpoint, there had to be something bigger than just Western medicine. Mm-hmm, mm-hmm. And that's kind of where what we lovingly call the studio comes into play. Very integrative wellness is a culmination of mental, physical, spiritual, external and internal health and well-being. Spiritual health and well-being. We started the studio. It's me and my two best female girlfriends, Dr. Crystal Price and her wife, Christy McCormick. Mm-hmm. So I work with Dr. Price at the hospital in the ICU, and I've worked with her for the last 7 years, and we were in the ICU together. We still work there full-time together in the ICU. And in a post-pandemic sort of survival world, we said there's got to be something bigger than this, something better than this. And how can we take care of the whole person in ways that we can't do that in the hospital or in conventional Western medicine? And that's where we've kind of delved into an Eastern meets Western little niche of what we do. Dr. Price spearheads all of your metabolic health and wellness, and specifically focused on like women's perimenopausal, menopausal health and well-being. And that's a whole other conversation that we can get into that lacks in Western medicine and healthcare, and women being suppressed and unheard and not taken seriously from that stage of their lives.
There's going to be a part 2.
Oh yeah. That's a whole nother, that we can talk for hours on that shit, man.
We got the sequel in development. Absolutely. Hell yes.
And then, dealing with that and seeing the things that we see in the hospital as a consequence of perimenopausal and menopausal mismanagement or lack thereof in general, and, women in their 50s and 60s getting frequent urinary tract infections can be deadly, and that can be easily fixed with a little bit of estrogen therapy. Not even systemic, just like topical, and little things like that, little things like that we don't take seriously because men said so about 25 years ago, said that this is not important. I can tangent.
It's a good point you're making. You know what I mean?
Yeah, man.
Oh my God.
So like this, we're trying to fill this little niche of medicine and healthcare and supporting women's metabolic health, and we do some men's metabolic health and wellness as well, but women-centered care is kind of our niche and our specialty. But when you come in, oftentimes we think of ourselves as like a triangle, so we're each a point of the triangle, right? And Christy is our nurse, but she's also our massage therapist and Reiki master. And then Dr. Price is obviously your doctor of osteopathic medicine physician. And she does your metabolic health and wellness and your weight loss and things like that to kind of support that person from the metabolic perspective, or the inside of your health. So oftentimes I'll get patients coming to me looking to fix their faces or feel more confident, or looking to do some anti-aging treatments and feel better physically on the outside. But you sit in my chair across from me, and then we're going to have a whole ass conversation about your mental health, your physical health, your hormonal health, your cortisol levels and your stress levels and your diet and your exercise and your general lifestyle and how you take care of yourself and what that means and how that manifests on the outside. And I will often identify and go back and forth between Dr. Price's patients and Christy's patients, my patients, and we have all these conversations, and we wind up just sending patients back and forth to each other to try and support the mind, body, and whole self and internal and external health and well-being and match our insides with our outsides. So that's kind of how that whole triad comes into play.
Okay.
Yeah.
So kind of getting into what you were talking about people wanting to like alter their bodies and whatnot. Based on, so the research I've done on you, you spoke about being like immersed in diet culture early on. Were you overweight at any point, or was it just, okay?
I grew up yo-yo dieting my whole entire life, yeah. I was a Weight Watchers lifetime member at 12 years old.
Holy shit.
Yeah.
God.
Yeah, Jenny Craig all through all the things, up and down, again, what feels like standard white people problems, first world problems, but
it's not though.
But it's not, right? You're right. And then we can get into the whole world of GLPs and how life-changing of a medication it is, and what it was life-changing for me, and I was on it for almost 5 years, and it has taught me freedom in ways that I never knew could have ever been possible, that now that I'm off of it for the last couple of months, I'm living a normal, healthy life mentally and emotionally, and have a much better relationship with food because of them.
I mean, yeah, 13 years old. Wait, was I 13 or was I 12? I was between 11 and 13. I remember wanting to order a fucking diet patch.
Exactly, right?
And I'm
90s diet culture. What the hell, man?
That's what I'm saying. You know what I mean? Because I wanted to be, because I felt ugly to women. You know what I mean?
Right.
To girls, and I constantly feel that. I'm like, well, maybe if I got fucking washboard abs, they don't think that.
Right?
You know what I mean? And I would just get so fucking obsessive with exercising.
Exactly.
You know what I mean?
Exactly.
And dieting and shit, man. All to fit within this mode, within this mold of beauty. You
Correct.
know what I'm saying?
Right.
And it's so fucking hollow.
Right.
You know what I mean? And it's like,
well, that's another, not to cut you off, but
go
going
ahead.
back to, the addiction side of things, a lot of my addiction was a lot of control as well. So I controlled my diet and over-exercised and, was a sports overachiever because of all those things as well. So, it all kind of snowballed.
God.
Yeah.
And now I'm trying to develop a better relationship with it.
Yeah. Definitely, and being in your late 20s and now early 30s is a whole new mind frame shift in perspective in terms of what your metabolic health means and the weight, literally and figuratively, of what you carry and how that's going to affect the rest of your life, going on from your muscle mass, your bone density, and how important these things are, and how unsafe and unhealthy it is to just yo-yo diet the way that I was. When you're younger, you can bounce back and you'll regain the muscle and your metabolism will kick back up and you'll redeposit your bone density. Okay, fine. But in our late 20s, now early 30s, I don't know. You're
30, I'm 32.
You're 30, so we're about the same age?
Absolutely.
Now is where our metabolism starts to plummet, and when we yo-yo diet and we lose muscle mass and bone density, we don't gain it back as easily as we used to, and it's extraordinarily hard to prevent that loss, especially at this stage in our lives, and doing it mindfully and slow and purposefully now is more important than ever. And people are jumping online and lying about their BMI and begging practitioners that they don't know from God knows where, Amazon Pharmacy or Mark Cuban's pharmacy for GLP or whatever pharmacy.
Mark Cuban's got a pharmacy?
Oh yeah, of course he does.
Wow.
Yeah, bro.
Oh, Mark Cuban, goddamn.
Yeah, man. But yeah, Amazon Pharmacy, you can quick order your GLP straight from the manufacturer these days, and people are just dropping body weight, but they're also losing all of their muscle mass and their bone density, and they don't recognize that in another 10 or 15 years when you fall and you break your hip, that could be a life-altering injury, and some people leads to all-cause mortality.
Dropping body weight and slowly dropping sanity as well.
Right? Yeah, man.
Oh my God, you know what I
Yeah,
mean? Yeah,
100%.
when I was so I would go so hard. I'm like, yeah, I'm healthy as fuck.
Right.
Not realizing that mentally, oh God.
It's the whole other end of the spectrum.
Ugh.
Yeah.
Have mercy.
Right?
But I did want to get back into the Reiki thing.
Yeah.
Into the energy healing.
Mm-hmm.
Reiki asks people to trust something they can't measure. What personal experience made you willing to explore that path?
I think, going back to losing my mom, I grew up in a Christian-ish household, going to church most Sundays of the year. When that part of my life started to spiral out of control, I lost touch with what is God, who are we, what greater being is there a greater being? I don't know. But knowing that there is something greater than this, and I just didn't know what or what that meant, and I don't even know that I have a definition or what you would even call it at this point in terms of spirituality and what I believe or don't believe. But once I met Christy, she basically asked/told me that we were going to do some Reiki.
And what year was that?
Maybe 23.
2023, okay.
22, 23, because I was dealing with a lot of mental health stuff as well post-pandemic. I was on a high dose of an SSRI and some hefty dose of Zoloft, and with the pandemic and all of that stuff, I put on almost 50 pounds again, yo-yoed up 50 pounds, and I was not in a good place mentally and physically as well, and trying to get all of that back on track. She said, why don't you try this? And I was pretty desperate because I was feeling lost and hopeless and confused and had no sense of self in the post-pandemic world. And I was in a leadership position at the hospital, so I felt important in that perspective. And then when I came home and all that went away, then who was I behind closed doors? I was no one, just like everyone else. And I had nothing to show for it at home because we were all locked in our houses, and I didn't know what that meant or who I was really at the end of the day. So I kind of just gave into it, and I'm glad I did. It
brings you so. The thing about Reiki is, like, no matter if it's a negative experience or a positive experience, it's always what you need.
Right.
You know what I mean? Because if it's negative, it's going to bring your issues to the forefront of your mind and force you to deal with what you've been hiding from.
Right.
You know what I mean? Explain to me your first Reiki experience. What was that like?
So Christy was early. I think she was earlier in her practices, but newly a Reiki master, and was basically using me as her guinea pig to practice new techniques on. And I just said, sure, fine, whatever, I'll go for it. And I remember laying there and her barely touching me and seeing, with my eyes closed, I had eye mask on, light shows in my brain and pictures and kaleidoscopes that I thought I was tripping on drugs. And I didn't know what was happening or what it was or why it was happening, but I just tried to succumb and give into it. And actually, you know what? I lied. Going back before all that, my very first experience with energy work, when I was early, I think this was probably even before the pandemic, I did a lot of hospice work in the hospital. I still do it from time to time. But we have a hospice inn at the hospital, and one of the more seasoned nurses who's been in the area for God knows how long, I was having a rough day, and she said, let's do some energy work on you. And I was like, what the fuck's that? Oh, sure, fine. And she put me in one of the hospital beds, and all I could remember was saying to myself, God, so many people have died in this bed, and I can't believe I'm laying in it right now. There's so many people, whatever. And she just started doing some energy work on me.
The irony.
All right, I know. And I felt like I had magnets in my hand, and I've never experienced anything like that. And she's like, yep, that worked. I said, I just felt like I had the weight of magnets pulling my hands together, but also heavy in ways that I never could have experienced. I didn't see the light show thing, so I was like, this is interesting. But then I kind of put it on pause and never thought about it ever again until Christy kind of brought it back up.
It's almost like the power of you were holding it almost.
Yeah.
Would you say?
Yeah, she was she was balancing and clearing and charging and.
Reiki is beautiful,
Yeah.
but Reiki is fucking weird.
Right? Yeah.
You know, I mean, essentially, it's not like you're lying
on a bed of some sort, whatever.
Yeah, however you're most comfortable.
The practitioner is channeling energy into your various chakras. It's 7 chakras, right?
Correct.
And the history of Reiki, I forget the entire story, but some guy was like, I don't know if he was hiking up the mountain or coming down the mountain, but I think he broke his ankle or some shit, and he used Reiki to heal his ankle. That's what they said.
Yeah, he did a lot of his own, a little bit of history that I know, he did a lot of his own soul searching and energy. He tried a lot of different healing modalities and energy practices for himself until he went into a cave and did some prolonged meditation in a dark cave and came out enlightened with his own energy practice, and he called it Reiki.
You know,
and then shared it to a select few practitioners, and they've kind of realmed it into what it is today.
Because 2018 was the first time I heard of Reiki. A friend of mine at the time was trying to audition for American Idol, and he was like, "Hey, you want to come do Reiki with me?" And I'm like, "What the fuck is that?"
Yeah,
you know what I mean?
This is some crazy hoodoo voodoo shit, man.
Yeah, and he told me about it, and this was, I mean, mind you, I've done some shit. I've done plenty of acid and shrooms and whatever the fuck else. I've been out of this fucking world.
Yeah.
But when he was telling me this shit, I was like, this sounds like hocus pocus.
Right.
But I'm like, whatever, I'm not fucking doing anything. I was visiting at the time. I was living in Vegas.
Right.
You know what I mean? I was visiting
You're just
home.
vibing out, man.
Hey, fuck it, why not? Excuse me. So I said, fuck it. I went with him. I had no expectations. I'm like, whatever. I'm going to lie in this bed and I'm going to catch a nap. I'm going to catch
Right?
some
You're just
Z's.
going to vibe for a little while.
So I went there. I laid on that table, closed my eyes. These 2 women, they were these 2 old women. They were so adorable. They were like these friendly witches.
Yeah.
It was like, oh, they're so cute. You know what I mean? And they were so friendly. And yeah, they channeled energy into me, and I tell you, Jess, it was
It's otherworldly, right?
I saw what I perceived to be heaven, and I'm closing my eyes just so I can like picture it, so I can really accurately describe it. Like the sky was clear blue. You know what I mean? The sky was blue as hell. It was sunny. The clouds were fluffy, like billowy as hell. It was, and there's like this palace. You know what I mean? Big pillars, marble floors, shiny. You know what I mean? And I'm walking on the floors, and there are these boxes. These clear boxes with these crisp edges and sharp corners.
Interesting.
And they had gold tops on them. You know what I mean? They were going up and down simultaneously, like fast, but in slow motion.
Interesting.
And just the colors that were reflecting from them, it was like this iridescent detonation. It was one of the most beautiful fucking things I'd ever seen in my fucking life.
Right.
I woke up from that shit, and they had to give me water and say, listen, you can't drive right now.
Yeah.
And I'm like, dude, I felt like this energy surging through me. It's like I could feel my potential within me. Everything that I was suppressing, it's like I could feel it within me. Mm-hmm. It was wild. It was weird. It was fucking wonderful.
Right.
Wild, wonderful, and weird.
Yeah.
You know what I mean?
It's so healing in and of itself.
And yeah, I mean, they were, I literally hugged these women. I laughed with them. It was incredible, but I was literally floating, man. Like, if you could change the system without any obstacles in your way, like you being a medical professional, if you had the ability to, somebody said, listen, you have the power. You know what I mean? We're going to let you change this, and we're gonna let you create the change you've always wanted to see. You know what I mean? You don't have to worry about money. You don't have to worry. No one's standing in your way. Nothing. Total autonomy. What would the medical system look like in terms of how you treat people? Like, you know, the people with cancer, people with mental illness. Like, how would you go about that?
That's a loaded question, man. I don't know that we got enough time to talk about that.
Fair enough.
No, it's honestly, step number one would be just allowing enough time for patient and provider to sit and get a better understanding of each other, where they're coming from, what their goals are, what their expectations are, and what their limitations are, and how to respect each other's boundaries. And making sure that everyone is making their own informed decisions, and that the patient has all of the informed consent that they need to make their most educated decision for themselves, and being in charge of their own care rather than being told how to take care of themselves. That's step number one. And we unfortunately don't let that happen here. I can tell you there's a lot of really amazing people in our community and in the greater community that are trying to break the mold and do their own thing in that aspect. Like if you know anything about DPC or direct primary care, I've got a really good friend of mine, Dr. Megan Monty. She's one of my good friends and, you know, a colleague of mine and a good friend. She's breaking the mold by doing these things exactly for those exact reasons, so that she can take the time and start from some square one, from ground zero, with every single patient that she sees, and provide them the care that they deserve, and the time that they deserve outside of the constraints of insurance-based care. Is insurance limits everything that we can do, limits every test that we can perform, limits every prescription that we can send, makes us have to jump through hoops and hoops and hoops and hoops to get the patients the care that they deserve and the care that they need. It's an interesting cycle of just continuous chasing your tail in the American healthcare system. But being able to just, again, start from ground zero, whatever you want to call it, and giving the patients the time that they deserve is oftentimes the best thing that I think that you can afford and offer a patient, is just giving them the time and the space and the compassion that they need to be heard, and just letting people tell their story. That's where I would start. We don't have the capacity to be able to do that.
Fair enough.
Yeah.
Let me ask you this. Take something like cancer, for example.
Yep.
You know, a lot of people don't want to do chemotherapy and go through all these things because, I mean, I've never experienced cancer, obviously, but it exacerbates a lot of the negative things associated with it. Do you believe there's a holistic approach to cancer? Do you believe that it can be cured?
Without medicines?
With more natural medicines?
You know, I don't know. I've struggled with that for a long time, you know, delving into the holistic side and Eastern medicinal practices a little bit here and there, and doing a lot of naturopathic healing myself. I think that there is a role and a big, important part of diet and lifestyle in terms of your management and overall care. But there's a fine line between holistic care and when that's not enough, then where do you go from there? You don't have a choice but to rely on the Western practices and the Western medicines. And unless you are, you know, in the later stages of your life and you're completely okay with that and what that means for you and how your life is going to progress, if things are progressing. But for younger people, sometimes it's just not enough. And when it's not enough, then sometimes we don't have a choice. And unfortunately, the few choices that we do have, again, are dictated by insurance. But I think that there is a fine balance of holistic health and wellness and keeping yourself healthy and more preventative than anything, stress management, your diet, your lifestyle, exposure to toxins and forever chemicals and all those things. I think that's absolutely 100% true.
Toxins and carcinogens and all that
Carcinogens
shit.
and your forever chemicals, your plastics, your microplastics, and clogging up our reproductive tracts and shit like that.
And they put all this shit in the food. And
Oh yeah. I mean, from the skincare that we use to the deodorants that we, that sort of shit. Speaking of cancers, like growing up on Long Island, they used to say Long Island's the breast cancer capital of the United States.
Really?
Whether that's true or not, but I grew up being told that's the case, and the factories, the land, I don't even know what our lifestyle, who knows, but a big population of women down on Long Island have breast cancer, have dealt with breast cancer. My mother was constantly screened. My grandmother died of breast cancer complications, and she had the BRCA mutation, so she was predisposed to developing. So that's a genetic issue in and of itself. Not something that she asked for, not anything that she whatever developed, whatever. That's something that she was born with. And you can screen for things like that. But my mother did not have that mutation, the BRCA mutation, that would predispose you to develop things like breast and ovarian cancer. But I specifically remember her going to the appointment with her as a child, and the nurse saying to her, "Girl, you live on Long Island. Doesn't matter if you got the BRCA mutation or not. You're going to get breast cancer one day." So it was, so she continuously had close screenings, and I've had a couple of screenings here and there myself because of my predispositions and where I grew up and whatever. But then also I'm thinking of other things like neurological diseases like ALS. So Dr. Price, she's also one of the medical directors of one of the ALS clinics in our community.
Okay.
And she tells me all the time that ALS is a disease of wealthy people, interestingly. People, and if you think about it, and the populations of people that you see are doing really cool things, like they're golfing or gardening, or they're doing
Football?
Yeah.
Chris Johnson of
sports, right?
Yeah.
Lou Gehrig, baseball, all these things. And when you think about it, what do all these people have in common? Pesticide exposure.
Wow.
Yeah, landscapers, gardeners, sports athletes, golfers. And then, interestingly enough, things like electrical shocks, there's actually research and data tied to being electrocuted, whether it's by lightning or touching the socket. All of those things, for whatever reason, these random issues can predispose someone to these sorts of diseases. There's crazy shit, man. Yeah.
Damn.
So are we injecting people with illnesses and diseases? Not directly, but are we excessively exposing ourselves to things that can potentiate these sorts of illnesses and diseases? Yeah, absolutely.
And are we aware of it?
Right. No, we're not, clearly. It's not like we're out there rolling around in the grass when we're playing golf, but we're standing around picking up balls and,
Okay.
Yeah.
And how's everything here?
As we approach the latter end of it, we got about 4 questions left for
Sure.
you. I really appreciate your insight.
Absolutely, man. Yeah, we could talk for days.
Fucking preaching. What belief about yourself have you had to fight the hardest to overcome, and what finally helped you loosen its grip?
That I wasn't good enough and that I didn't deserve the things that I was doing. And I think Reiki had a big part in me coming to know who I am, and just the process of personal healing, and knowing that the things I've done and the things I've accomplished, I did them myself and no one else did it for me. And I mean, I still suffer with imposter syndrome quite a bit. But then I also turn around and say, who the fuck did all that shit? I did. Mm-hmm. That's really cool. Mm-hmm. And
goddamn right.
Reiki has helped ground me to understand all of that, but also stay humble and appreciative and acknowledge all of the things that I do and the gifts that I do carry, and the love that I can pour into others and myself and the community, and stay grounded and humble from that perspective, and share those gifts and that empowerment with others.
Okay.
Yeah.
looking back across your life, what season of pain has quietly become one of your greatest sources of wisdom?
I think in the more recently, putting up boundaries with my sibling. Coming to know that we can still love someone and wish and hope the best for them, but be on different timelines or trajectories, and sometimes our chapters aren't written in the same book, and that's okay. And coming to know and love and understand that, sometimes we don't always see eye to eye, and I thought that we did. And maybe one day we will. But at this point in my life right now, it's not what fits in my life, and unfortunately it pains me. I feel like a martyr, and white people problem saying this shit, but I don't know. Sometimes you just can't. It's not. I guess what I'm trying to say is I've learned, and it's taken me a long time, that you don't need to save everyone. And the last person I think I was trying to save was my sister, up until my adult life, until maybe these last 2 years. And Reiki has also helped me to understand that it's not my path and not my journey and not my purpose to save everyone.
That's a fact. I used to always say, it's funny to, you can't change people.
Correct.
You know what I'm saying? And I was just like, you gotta just lead by example.
Right.
And, those that it speaks to, they'll follow.
Right.
You know what I'm saying?
Exactly.
But you just gotta live your own. You gotta live your life to the best of your ability. Lead with verity. You know what I mean? And those that it speaks to, they'll follow suit in a way that makes sense for them.
Exactly.
You know what I mean?
Exactly.
But it's like, in the midst of fighting for what we truly believe, we can become what we hate the most.
Exactly.
You know what I mean? And it's important to realize that, because we can have good intentions and still be doing fuckery.
Right.
You know
Yeah,
what I'm
literally.
saying?
Literally, yeah, literally.
Yeah.
And I was falling, when people are committed wholeheartedly to misunderstanding you and judging you for all the things that you are not, it can be, it caused me to spiral for a while, and again, as an adult, question who I am, what I'm doing, and the things I've accomplished, and if you can separate yourself from the commitment to misunderstanding and commit yourself to understanding yourself in ways that, I don't know, I guess it's a form of self-love and self-care that I never knew that's what I was missing. And I think it took me up until these last few years to actually understand that I needed to commit to understanding myself and coming to know who I am and what I bring to the table, and saying, fuck yeah, I do bring all that shit to the table, and I am a good person, and you are a good person, and deep down inside I believe everyone's a good person. It's just a matter of how you express yourself and how you communicate and deal with your own personal experiences and traumas, and then how it's managed. Everyone's different from that perspective, but as long as you come back to yourself and are able to stay grounded and humbled in that, and by all those experiences, I don't really know what more I can bring to the table at that point, and what more I'm trying to prove. So I need to just stop trying to prove shit to everyone else and just prove it to myself that I am who I am.
That's a fact, man. Fuck seeking approval from
Right?
others, man.
Yeah.
When people meet you today, they often see the accomplished PA and wellness practitioner, but what part of your story do you wish they understood before making assumptions about who you are?
I think that surviving and thriving is possible, and that healing is possible. And that it takes a lot of hard work and dedication to finding the compassion to understand yourself, and like you were saying, really digging down and diving deep and dealing with those demons face on, and really stemming back to early childhood and day one and dealing with your shadow work and all your deeper traumas and past lives and all that shit, I think it all plays into part. But knowing that if I can do it and come back and thrive, I think I'm thriving. I'm blessed to say that. I think it's possible for just about anyone else too, and I wholeheartedly believe that. But if you got to surround yourself with the right people. You got to surround yourself with the right people that uplift and empower you in that perspective, and you got to find your tribe to be able to do that. And I'm grateful that I found my tribe, and now I get to do that with others and do that, help others do that, and that's the biggest blessing.
Rock and roll.
Yeah, man.
And my last question here for you, Jess, on the wrap up. When your career, your titles, and even your interest in medicine and energy work are stripped away, who do you believe remains at the deepest part of who you are?
Yeah, I think I'm just a girl that's still trying to enjoy the beauty of this life and everything that the world has to offer and all the abundance of nature and life and I don't know. I often ask myself that. Like, who am I actually past the accolades and the titles and shit like that? And I think it's taken me up until the last year or two to actually be at peace with just being a human. And understanding that that's sometimes enough, and it's enough to slow down, and you are worthy of slowing down and taking a deep breath and enjoying all that life has to offer and everything that the beauty of this universe has to offer.
Some Socrates shit, like, who are you without it?
Right?
You know what I mean?
Yeah,
Absolutely.
man, exactly.
It's important.
I don't know that I know.
You know?
Yeah.
You don't know that you know, but you know that something exists there.
Yeah, I think we're all just souls kind of floating around and inhabiting our bodies at this point, and it's a matter of what you do with your body and how you best take care of yourself to enjoy the limited time that we have here on this plane.
That's what's up.
Yeah.
Before we wrap up, though, I want to be able to plug in your socials and any events you have coming up. So please, please share your Facebook, Instagram, TikTok handles, anything you have so people can find you.
Yeah, thank you. So I'm just breaking into the social media world. That's a whole other full-time job in and of itself. I'm sure you know that. It's a lot of fucking work, especially for an introverted empath. It's a lot. So I'm on Instagram and TikTok. My Facebook is private.
Fair enough.
But really so is Ray Integrative Wellness on Instagram is ray.integrative.wellness. And then
REI.
REI, yep, Ray Integrative Wellness. And Ray being shorthand for Reiki.
Reiki, yes, absolutely.
And then my Instagram handle personal, where I do a lot of just like holistic wellness and self-care and, you know, that sort of posty sort of shit, whatever you want to call it. JessPolins.PA_Ray.
Okay.
Is my Instagram. Or Jess Pollins PA is my TikTok, Jess Pollins PA. I recently broke my ankle early in May, so I've been learning a lot about slowing down and taking care of myself. So
yeah, you posted something that you may not feel like you're doing enough, but you are. Like, do you remember that post?
Yeah.
Yeah. What did you say exactly? I fucked with it. I was trying to tell my uncle this, but I'm paraphrasing like a mother.
Yeah. I saw a post where it said something along the lines of. Basically along the lines of like it's okay to slow down because you're already doing enough, and we often live in a world where we are defined by productivity, and I often gauge my day on how successful it is by how productive I am, and my ankle really slowed me down. I was immobile for almost 3-4 weeks straight and was on crutches for 2 months straight, and it really taught me that slowing down and doing enough is probably already enough.
They say when you won't, God will.
Yeah.
You know what I mean?
Yeah, it really
you
taught
won't
me.
slow down? All right, I'll slow your ass
That's
down.
exactly,
buddy.
exactly,
You know?
exactly. Yeah, it slowed my ass down. That's for sure.
You have any upcoming energy events or anything like that you want to shout out? Maybe that your team is holding or anything?
To be honest with you, not right now. We're kind of in the downswing of summertime, especially after my injury. We had some things on the docket that we postponed for the time being. Now that I'm back up and running, so if you don't mind, I'll keep you in the loop with those. But right now, nothing major on the docket right now.
Okay. And as far as those candles go,
Oh yeah.
where can people buy them? You know what I mean?
Fair enough. Good question. So I sell all of my candles on Etsy online. If you're looking to like do anything personal, you can shoot me a message and we can coordinate that way. But in store, I do sell them at our studio at Ray Integrative Wellness in North Greenbush.
What's the address?
48 North Greenbush Road.
48 North Greenbush Road. What's the zip code?
12180.
All right.
Do you know where Juniors is over by Hudson Valley Community College?
Yeah.
We're in that same strip mall.
In that same strip mall?
In that same strip mall.
All right, rock and roll.
Yeah,
Rock
and
roll.
you know what? Speaking of which, to say thank you, I brought you some to say thank you.
I was wondering what that was.
That's for you.
Okay.
I didn't realize there were two of you, otherwise I would have brought two. I'm sorry.
Oh, shit.
So,
John?
I
John?
intuitively picked a couple of different things for you.
Man, this shit smell good as hell, Jess. Goddamn. John, we gotta get this in the show. We gotta zoom in on this, man. Come on. Oh my god, yeah.
So that's an essential oil.
Oh my god. Look at this.
Oh, it's an essential oil energy grounding clearing spray. It's skin safe.
Oh, it's
linen
good.
safe.
I was just
Yeah,
about to say, can I spray this on my
absolutely,
hands?
absolutely. All high grade essential
God.
oils.
Oh wow.
So you can spray it on your person,
Woo!
charged with crystals, and then if you like to get a little hoodoo voodoo witchy little foo-foo, that's like a little you can set up like a little altar with that and do some intention setting and some prayers or whatever you like. That's like an abundance sort of love attraction little like spell jar almost if you wanted, if you will.
Oh my god, it smells incredible.
And then that's a nice energy clearing scent.
Ooh. Oh my god. Palo Santo?
Yep, Palo Santo, yeah.
Palo Santo. Oh my god. You made this shit yourself.
I do, man. Yeah, on my downtime, right? So everything's made with clean burning ingredients. You've got natural coconut and soy waxes. You get a cleaner burning wax rather than your big box candle stores that are filled with paraffin and carcinogen like shit. Yeah. And then all the fragrances that I choose, I personally go through all of the safety data sheets to make sure they are as least toxic as possible.
She's not using any of these cancerous agents in these beautiful things. No, she's not. Oh.
I mean, there ain't no synthetic fragrance that ain't toxic to some degree, but at least you know you're getting something that's as least toxic as a healthcare provider can provide.
Yo, this is awesome. Oh my god.
Thanks,
Yeah,
dude.
I was eyeing that bag. I was like, I don't know if she brought some gifts. I don't want to assume, but goddamn, Jess, oh
A little
my
bit of
god.
it's just a little gratitude, man.
Oh
Just
my
putting out in the
God.
world what I try to attract.
Oh my god. Intention RX Candle Company, Albany, New York, goddamn it. Oh my god.
Yeah, so
Jess, this is fucking incredible. Thank you so much.
appreciate you, man.
Oh my god, I appreciate you.
Yeah. So a little play on the Reiki, the intention, and then the medical prescription. I'm prescribing whatever candle, whatever.
Yo,
You get it.
rock and roll, man.
Hell yeah, man.
This is fucking incredible.
Thank you.
Jesus, thank you so much for your time. I need to give you a hug, goddamn.
I was gonna say, can I take this off? Can I give you a hug?
Yeah, absolutely.
I'm a hugger.
Ah,
Appreciate you, man.
my God, I appreciate you.
Thanks for having me.
Thank you for coming. Thank you for making time for this.